Now, from CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to Facing South Florida. I'm Jim DeFede, and this week, State Representative Danny Perez was formally designated to be the next Speaker of the Florida House, making him one of the most powerful people in the state when he becomes Speaker in 2025. He seemed to take a shot at Governor DeSantis when he gave his acceptance speech, saying the House should take the lead and that it should stop passing bills with vague titles that people don't really understand or really affect their day-to-day lives. I asked him about that. Now, Perez is the second Speaker from South Florida in the last 10 years, and it was also a position Marco Rubio once held. When we spoke this week, I asked Perez why he wanted to be Speaker.
One of my priorities is making sure that we help Floridians with the affordability of living here. The economy has kind of taken a dip here as of late, and it's going to hurt us. But we need to make sure that here in Florida, we give people the opportunity to stay here. I don't want to lose people to other states. I want those that were raised here, were born here, that live here, that want to start their careers here and their families here. I want them to stay here. And I'm seeing an exodus of people because of affordability, and I don't like that. So it's not huge right now, but I don't want it to get to a level of concern.
I know I watched some of your comments after you gave your speech last week, and it seemed as if one of the things you did talk about, though, was property insurance. That when you talk about going door to door in your district and just sort of talking to people, that issue 1, 2, 3, and 4 on their list all revolve around property insurance, I think you said. So realistically, the legislature has passed a number of bills, but we're not quite seeing the results yet. So what do you think needs to be done next with regard to property insurance?
Property insurance is an important issue. I think we all agree on that. There isn't a member in the Florida House, again, either side of the aisle, that will tell you property insurance has been resolved. It's a tough topic, Jim. You know, personally, I had a 120% increase on my homeowner's policy. And as I like to state, like, I'm a regular dude. I'm not a millionaire. I got to pay my bills, and it's tough when your homeowner's insurance goes up 120%. So I understand the frustration that Floridians have. We've been chipping away at it, but you know, I would love for us to continue to see what other solutions remain, if there are any. And I know Speaker Renner understands the importance of that as well. He has stated it himself. But this last session, you know, experts believe that the bill that we passed on insurance reform was going to take about 18 months to start to see the fruits of our labor on that bill. And I've been talking to a lot of the carriers, in-state carriers on homeowners policies, and we're starting to see the positive trend. And I'll give you the reasons why I feel that way. One, there's about 400,000 policies that Citizens is about to start to move over off the Citizens payroll, and I think that's important. The Citizens shouldn't be in the private business of insuring people. It should be the insurance of last resort. But right now,
wait, let me just stop you there. You do know what ends up happening to those 400,000 homeowners who get shifted out of Citizens. They are going to see dramatic increases in their rates when they get taken out of Citizens and placed into a private insurance carrier. You're ready for that backlash, correct?
Well, Citizens is going to be significantly less than most private insurers, and we understand that. We've always understood that's always been the way it's been. But with the increase of competitors that are coming to the state of Florida, there are 2 new carriers that we expect to join the state of Florida. Hopefully, with the supply going up, it starts to stabilize the market. But we have to begin to chip away at what that looks like. But Jim, before I answer the rest of your question, when I was talking to the carriers here from the state of Florida, I started talking about, you know, when are we going to begin to see that stability in the market? When do we begin to see, I'm not even asking for a decrease in rates. When do we see the lack of an increase? We don't want that 12, 13% increase that's happening right now, which is still high and better than most at 120%. But 12 to 13% is still high. And some of these carriers are telling me we're actually expecting it by July of next year. Which would be probably around 12 months as opposed to 18 months. So there's a lot of information that's going to be coming out here in the next month. And, you know, the leadership of Citizens has stayed in touch with the leaders of our communities across the state. And I actually spoke with them last week. And I said, you know, I want Floridians to understand what is the progress that we're making as citizens? What is the progress that we're making in that private market with competitors coming into our state? Because we have to message it properly. The most important message that I can relay, and Jim, not just to you, but to all of our viewers, the most important message that I can relay is we're not done working on property insurance. We have chipped away. We are working hard on it. But at the same time, we understand your frustration. I am just as frustrated. We will continue to work on this issue to find that solution until we feel confident that we've at least reached a middle ground to where the market is stable.
I watched your speech, I've read your speech, and I got to tell you, and I'm not alone in this, there were a lot of people who saw this as a shot across the bow at the governor. You were talking in your speech about how the legislature is the first branch of government. You were talking about not wanting to get trapped into passing bills with fancy titles that don't really do a lot. You were talking about the fact that just because government can pass bills when you've got a supermajority doesn't mean you should be passing all the bills you are. Was that a shot at the governor?
No, it wasn't a shot at the governor. And look, those are all facts that you just stated, and you're right, Jim. Those were in my speech. And it is important that that people understand that the purpose behind that message. The legislature is the closest body to the people, and that's our job. Our job is to represent the people. I always say my boss is my constituent. That's who I work for. So I did want to relay that message to the people, that we are the closest body to you. And so I want to make sure that they understand that. But also, Jim, elected officials spend a lot of time away from their families to go to Tallahassee in order to advocate for what they believe is the best interest of the next generation of their district. But in doing so, I want to make sure that they're using their time wisely. I want to make sure that they're filing bills that have purpose, that really matter. Jim, one of the most important things that I said on Monday, in my opinion, was I told the members directly. I said, if you have an entitlement because you're called representative or chairman, then you're going to disappoint me, because that's not what being an elected official is about. It's about answering to your constituents. So if you have something to say, make sure it's something unique. Make sure you aren't filing the same bills that have been around for decades that just fill a box for some special interest. We're not up there for special interest. We're there for our community. What really changes the lives of your constituents? That's what you should be following.
So let me ask you that. So does having debate and vitriol around whether it's drag shows, for brunch, or whether it's, the so-called Don't Say Gay bill, it just seems as if the legislature has wandered into, rather than focus on a lot of the issues that Floridians really do matter in their lives, the legislature has spent a lot of time, in a lot of people's opinion, on culture war issues that really don't have an impact on people's day-to-day lives. How would you answer that?
Jim, I don't see giving a parent the choice on where they want to send their child to school, or giving a parent the right to understand that their third grader, their kindergarten child is learning about sexual orientation or gender identity. I don't consider that a social war, a culture war, a social issue. That has to do with parental rights. I don't think, and in any scenario, there should be a first grader learning about gender identity or sexual orientation.
Well, let me just hold you there on that. Wait, let me just hold you there on that point, because I know that legislators like to point out first graders shouldn't do this, or second graders shouldn't do this, or kindergartners shouldn't do this. The bill that was passed and the implementation of it does go all the way through high school.
It has to do with the parent understanding what that child is being taught, what that child is speaking, who he or she is speaking to, and what the conversations are about when it has to do with sexual identity or sexual orientation or gender identity. That's what it has to do with. A parent has to know it is a minor, and the parent has to be involved in a child's life. A parent has to be a part of that conversation. That's not a culture war. That has to do with parental rights.
Nobody is arguing that parents shouldn't be part of it.
Jim, let me finish. Respectfully, you have to understand that parents have to understand what's going on in this child's life as long as they are a minor. At 18 years old, if they want to go and talk and do whatever they want, they have that ability. They are an adult. But this is not about the LGBT community being boxed out. Quite frankly, it is the opposite. If a child in 12th grade, or a child in 3rd grade, or a child in kindergarten wants to draw a picture of 2 moms or 2 dads, they'll be able to do that. We're not trying to box this community out. This community has a voice, and they should have a voice. What's more important is that if the child wants to talk about sexual orientation or gender identity, the parent has to be put on notice. That's it. That's not a culture war, Jim.
What about the war on woke that we've seen? Is that something that you want to continue?
What does that even mean, Jim? What's the
That's
war
my
on woke?
point. What does it mean?
But I'm asking you, you're asking me the war on woke, because you told me a little bit ago, I don't want to put words in your mouth, Jim, because you're my friend and I like you. I always enjoy going on your show, and I always will. The tougher the topics get, the more I'll come on your show. That's why I enjoy coming on your show. But when you just asked me about the quote unquote Don't Say Gay bill, which is not the name of the bill, it's the parental rights bill, you would have put that on the woke category. And Jim, that is not in the woke category. That has to do with parental rights. We are trying to give rights to parents, but the media has put it into this culture war issue. That's just not true.
Nobody is arguing that parents shouldn't be included in their child's education. I don't know of a single teacher that I've ever spoken to that has said, you know, the problem with education, parental involvement. Just the opposite. Teachers want parents involved. But the problem is that the legislature has created an environment where teachers are afraid now. What is the role that you see the State House playing coming forward vis-a-vis the governor? Because it does seem as if the legislature ends up following the path of the governor as opposed to setting its own path. As Speaker, will you chart the course for the House, or is it going to be whatever the governor wants, we'll follow behind?
Look, let me start by saying that the governor has done a phenomenal job as governor of the state of Florida. If you look at just pure numbers, I mean, one, I think he's done a phenomenal job, but two, we also have more than 1,000 people moving a day. We have the lowest unemployment rate. We did the biggest tax cut, the largest tax cut in the history of the state of Florida, close to $3 billion. We just passed that. That comes out of the legislature. We are the ones that write the budget. We are the ones that create the law, and the governor is the one that either ratifies it or vetoes it. But the body of work of Florida comes out of the legislature. And that was the message. I want people to understand that the body of work that has allowed Florida to be exactly where we're at today, it comes from the legislature in partnership with the governor. And not just this legislature, not just this governor, but we've been doing this for decades. The Republican Party, which has had a majority in the House for several decades and the Senate for several decades, that is what has led to the wins of Florida today. It's why we have one of the 15 largest GDPs in the world. I mean, think about that for a second. In the world, one of the 15 largest GDPs. That's the leadership that we've had for several decades. I mean, it's not just us. It's not just Governor DeSantis. Rick Scott, phenomenal governor. Jeb Bush. I mean, we've had great governors for a long time. Same as
if you want to talk economics, why is Florida's inflation rate so much higher than the national inflation rate, so much higher than almost every other state?
All inflation rates come from one place, Jim. And it's 1600 Pennsylvania Avenue. That's
wait a second. No. But why is Florida's inflation rate higher than the national average, higher than most other states? Is 1600 Pennsylvania Avenue doing special policies that only affect Florida?
No, but here's the problem. In all these other left-leaning states, they have twice the budget that we do because they're collecting more taxes from the people that live in their states. And what are they doing? They're doing more repayments out from taxpayer dollars for reasons that they shouldn't be collecting dollars for. We have half the budget of New York. Half the budget of New York. Why? Because we tell people that live in Florida, keep the money in your pocket. When you come here, when you work hard, we don't want an income tax. We want you to be able to do what you want to do with your money that you work so hard for. The problem that we're having with inflation across the entire country, regardless of what state you're in, I don't care if you're in the greatest economy or the worst economy in the entire country, inflation comes from Joe Biden. And it is that simple. We didn't have this when we had a Republican president in office. We didn't even have it even close to the numbers that we're at right now.
When we come back, COVID is on the rise again in Florida, and I talked to Florida's former Surgeon General, Scott Rifkes. Stay with us. Welcome back. COVID is on the rise again across the country, and especially here in Florida. More than 100 people each week are now dying in Florida from COVID. In fact, more people are dying every week in Florida than any other state in the country. More than California, more than Texas, more than New York or New Jersey or Michigan. Florida also has the highest rate of hospitalizations due to COVID in the country. And the one thing the overwhelming majority of these people who are dying and who are hospitalized have in common is that they are not vaccinated. Nevertheless, our governor and his Surgeon General have come out and told people not to get the vaccine, to not trust the vaccine. The governor and the current Surgeon General, Dr. Joseph Ladapo, are focused on politics and not science. So I contacted the state's previous Surgeon General, Dr. Scott Rifkes, who DeSantis sidelined and then replaced. He is now a professor of public health at Brown University in Rhode Island. I asked him to explain what is happening now with COVID.
Yeah, so first of all, as we're going into our winter, late fall seasons where we see respiratory viruses, we really now have to actually think of the three major respiratory viruses, not just COVID: RSV, flu, and COVID. And right now we're not seeing much flu. We're not seeing much RSV. We anticipate that will happen later on as we closer to winter. But we are seeing COVID. Cases of COVID in the United States have risen over the past month or so, as reflected in hospitalizations and individuals who have sadly lost their lives to COVID. But it's important to point out that even though we're seeing a rise in cases now, it's much less than what we saw about 8 or 9 months ago.
You were sharing some of the numbers a second ago as it relates to Florida. What are the Florida numbers that you see?
Yeah, so first, in terms of nationally, overall, in terms of how we're tracking things now, we aren't reporting cases like we had before and collecting that information. So we're really looking at hospitalization data and loss of life data to really get important screenshots in terms of what's going on. So in the U.S., over the past 2 weeks, cases have gone up by almost 20%. Almost 30,000 people hospitalized in the United States with COVID per week, almost 800 deaths per week. And in Florida, we aren't seeing the rise like we before. It looks like new hospitalizations have stabilized at almost 3,500 new hospitalizations a week, but about 100 people a week are dying from COVID in Florida.
100 people a week are dying, and you're saying 800 a week are dying nationally. Is that correct?
Exactly, sir.
1 out of 8 deaths are currently coming out of Florida for COVID?
Yeah, yes. Again, Florida is one of the most populous states in the country.
That still seems like a high number out of Florida, nevertheless.
Well, we are losing about 100 people a week in the state of Florida and about 800 people a week nationally.
And you talked about hospitalizations in Florida being around 3,500. My understanding is about 3 months ago, it was about a third or lower than a third of that number. So we are seeing that trend tick up, which again gets to the point of what I was starting to allude to, which is the importance of getting booster shots for COVID. I know that the CDC and the FDA have approved now the new booster shots for the new variant within COVID. Do you think it's a good idea to get those shots?
Yeah, first getting back in terms of what we're seeing and what we can anticipate. So first, in terms of how long we are protected against COVID, and this actually goes to flu after you've had an infection or vaccination, it's about 6 months. So, if we had a major surge about 8 months ago, and we've had people vaccinated and haven't gotten the updated boosters, we're going to see periods of time where population immunity goes down. And as we have new variants, which we have, we're going to see these rises in cases, which we are seeing now. And both for the flu shot and also for the COVID vaccine, the protection you receive really lasts about 6 to 8 months of time. So now we're at a time where a new updated COVID vaccine has been released before the anticipated winter season. We're seeing some cases now, as we talked about. So in addition to getting our flu shot, we can also get the COVID shot at the same time. And also for RSV, again, a new vaccine out there to protect against severe disease to be considered as well.
I'm wondering what your reaction was to your successor, Dr. Ladapo, coming out very strongly in telling people not to get the booster shot. What was your reaction to that?
Yeah, so first of all, there's several reasons to get vaccinated, not just if you're older than 65, but also younger. So first, these vaccines have an excellent track record against protecting against severe COVID. And by severe COVID, I mean people are hospitalized or have lost their life. Since the beginning of the pandemic, about 25% of deaths have occurred in individuals less than 65 years of age. And particularly if one looks at the pediatric population, there have been 1,700 deaths. Most of those individuals don't have underlying medical conditions. So, this is why it's recommended that recommended by the CDC, FDA, other leading medical organizations, that even if you're younger than 65 years of age, get the vaccine. It'll protect you against severe disease. Second is that we can also talk about long COVID. Individuals who have COVID can have lingering symptoms, and with the Omicron variants that we see now, the feeling is that up to 10% of individuals can develop long COVID, something that if you're vaccinated, it'll decrease the risk of that. And then the third thing is, from a community level, population level, the more people that are protected against COVID, the less of a spread in the community, less of a spread, particularly to individuals who may be especially at risk, individuals who are older, individuals with underlying medical conditions. So this is why CDC, FDA, leading organizations recommend that individuals, including those less than 65 years of age, 6 months of age and older, avail themselves of the vaccine.
But not the Florida Surgeon General currently. And so I'm asking, as a scientist, as a doctor who clearly has an understanding of this issue, were you disappointed to hear Dr. Ladapo tell people under 65 not to get the vaccine?
Well, I'm going to come back. Let's look at the facts. 25% of the deaths that have occurred in people from COVID have been in individuals less than 65 years of age, including younger individuals, including children.
One of the reasons why Dr. Ladapo is telling people not to get the vaccine is because he believes it may not be safe. What can you tell me about the studies that you've seen as it relates to the safety of the COVID-19 boosters?
Yeah, really important question. And again, I want to refer people to the CDC website for the Advisory Committee on Immunization Practices, because the data are there. And what the data show is that these vaccines are very effective in preventing severe COVID, which is COVID resulting in hospitalizations and in deaths, and that these vaccines have an excellent safety profile. One of the concerns that had been raised is the risk of myocarditis. First, viruses can cause myocarditis. The risk of myocarditis due to COVID is much greater than the risk of myocarditis getting vaccines. But the most recent information that were presented, based upon the fall boosters that we saw last year, that there were 2 cases of myocarditis out of 650,000 doses. So that's an excellent safety profile.
Let me just jump in. And just to be clear, of the people who get hospitalized, of the people who die from COVID, what percentage of them have been vaccinated versus not vaccinated?
Yeah, based upon my conversations with individuals in hospitals, healthcare sector, caring for these patients, overwhelmingly, the vast majority of individuals who are being hospitalized now, passing away from COVID, have not been vaccinated.
I got my updated vaccine and flu shot on Thursday. We'll be right back. Thanks for joining us. You can follow me in the app previously known as Twitter @DeFede, and email me at jdefede@cbs.com. We'll be back again next week. Thanks again for watching, and enjoy the rest of your day.